In this video, I'm going to share with you 4 tips to help you sit back pain free and without any interruptions to your work or life. Hey, what's up YouTube? It's Coach Remy here. Sitting is one of the most difficult tasks for someone with low back pain. There are many questions that people may be wondering as to what's the best sitting posture? Why does my back hurt when I sit? How do I alleviate back pain when sitting? There's many questions, and in today's video, I'm going to be addressing these questions, but also sharing with you 4 tips to help you sit back pain free and to avoid any nagging back issues when going through your day. For tip number 1, we have to identify the type of chair that you are using. And there are many chairs out there, some good, some bad. But just to use an example here, if we look at chairs that I consider not the most spine friendly, we could look to an airline seat, which is very uncomfortable for someone that is especially tall like myself. And the reason being is because the seats are very hollow, so you tend to slouch or really sink into them. And that's not good for someone with existing back issues. And at the same time, with people sitting next to you, can get very crowded and tight, and that's just not a comfortable experience for someone that has to sit on a flight for 3-4 hours per se. But we can look to other types of chairs, whether it's a bar stool, or maybe it's a physio ball that people will sit on at work. The reason I'm not the biggest fan of those is just because they don't have any back support. And for someone that has existing back issues, when there's no back support, that may encourage more of a forward flex posture, and that can be uncomfortable for someone with existing back pain. But if we look to more spine-friendly chairs, I would consider any chair that has a good back support, where it fits comfortably to someone's spine, and maybe they can recline or lean back a little bit. And also the cushion is not too soft, but not too hard either. We want something in between, where we don't want something like a couch where you're sinking into it, because that may encourage a little bit of flexion in the pelvis and that can provoke pain. And we don't want something that's too hard or firm, because that could place an uncomfortable amount of stress onto the tailbone. We want something in between that is not too hard, but not too soft, and allows you to maintain a good positioning or a comfortable position when sitting. Now, we can also incorporate adding back supports. That's another little tip if someone doesn't have an ideal chair, where you can look to a back support that maybe inflates or deflates, and that may be customized to your spine. So that's another option as well if you don't have access to a good chair and want to improve your ability to maybe sit for a longer period of time. For tip number 2, we're going to talk about sitting posture. And this is a question I get often asked a lot about it, and people ask me, what is the best position to sit in? And there's no universal answer to this, because the best position to sit in is going to be different for everyone. And what I mean by that is people may be more comfortable leaning back, sitting upright, or maybe even leaning forward in some cases. And that's going to be specific to people's back pain and back issues. So my recommendation there is to find what works best for you and allows you to sit pain-free. Now, with a little caveat here. So when it comes to sitting, typically a forward flex posture is not the most spine sparing. You're loading the spine significantly more, and you're in a flex position, which can be provocative for someone that has flexion-based symptoms like discogenic back pain. Now, sitting upright, that's typically what is universally recommended, but I always found leaning back with a recline tended to be the best for my back. And the reason being is when you go on a recline, there's less stress and force on the spine, and there may be a little bit of less flexion occurring. So for someone with flexion-based symptoms, this typically can be the most spine sparing and maybe can save you an extra 10-15 minutes when, say, maybe driving or working at an office without the pain coming on. So that's another thing to just keep in mind there when it comes to sitting posture. Now, a couple other things just on sitting posture. You also have to be aware of your neck position. People that flex forward, that can provoke pain more. People that extend their neck, that can provoke pain more. Or in both cases, it can take away people's pain. So you have to be careful with the neck and also with your leg. If you kick your leg out like a soccer kick, people that have neural tension from, say, maybe a disc bulge impinging on a nerve root, that can really flare things up. So sometimes just keeping the knees bent can be spine friendly for the individual and avoid any symptoms from, say, coming on. Number 3, we have to talk about static loading. So anytime you sit, there's going to be this buildup of stress. And the longer you sit, the more stress that's going to build up. And what that will do is it'll flatten the discs out and cause your discs to almost bulge out a little bit. It's kind of like if you were flattening a donut. that's what happens to our discs as we sit for a prolonged period of time. And that'll progressively build up the longer we sit. Now, with someone with an existing disc bulge, this is the reason why someone may get pain with sitting, because as the pain comes on, say they sit for 20 minutes, they're fine, but 25 minutes, they start to get pain. What is happening is that bulge is increasing inside temporarily. And maybe if they continue to sit, the pain keeps getting worse. And that's because it keeps flattening out the disc. So the simple solution is just to get out of that position, maybe go for a walk, lay down, maybe go on an inversion table to basically expand things out and to take pressure off of that nerve root. So the problem with this is that you want to take frequent breaks every so often. If you continue to sit in pain, that's only gonna make things worse because of the static loading that's occurring. It's just not a normal thing for our spinal discs, because our discs, you're robbing them of nutrition, number one, and blood flow by just really kind of pressing down on it for a long period of time. And sitting itself isn't going to create a disc herniation or anything like that, but if you already have an existing disc problem, that's where it becomes very problematic and you can be in a lot of trouble if you're not careful. So you have to find ways that you're able to sit pain-free. And like I mentioned, one way you may be leaning back with a chair that has a good back support. That can spare your back, but also just making sure that maybe you're breaking things up with your routine. Maybe you're going for a quick walk every 20 minutes. Maybe you're just standing up, doing work on a standing desk, whatever it is. That way you're not in that position for a long period of time and provoking any pain. And my fourth and final tip for you guys is to identify your sitting tolerance. Everyone's gonna have a different tolerance to sitting. That's gonna be dependent upon a person's back pain and back issues and the type of chair that they're using, and if they're using a back support or not. And what I mean by this though, in general though, is some people have a tolerance where they can sit 20 minutes until their back pain may start to come on. Some people, maybe it's an hour. Some people, maybe it's a couple hours or longer. But the important thing is, if you're someone that has existing back issues, and this is gonna be more specific to people with discogenic back pain, is that if you're sitting and the pain starts to come on, that's your indication that you need to get out of that position and loosen your spine up and get out of that position to prevent any pain from kind of rapidly increasing. Because the thing is that the longer you sit in that position, you're only causing more damage to the already damaged tissues. So you want to find your tolerance, identify it, and then before the pain comes on, that's when you want to get out of that position and loosen up. Maybe it's going for a walk, inversion table, walking around, moving around, just to loosen things up. But the important thing is identify that tolerance. And you'll also notice that over time, you may notice your tolerance to increase, and that may be through following a good spine stability, core exercise program, improving your technique to sitting and using different chairs. That's a good sign that you're incorporating good strategies to help you, prevent back pain from sitting, but also that your back problems are improving as well. So that's my fourth and final tip for you guys, is to identify your sitting tolerance and avoid letting the pain trigger. Get out of that position to just loosen things up. And those are my 4 tips that I'm sharing with you guys today. And I hope that these tips help you guys prevent any back pain from coming on with sitting, or at least gives you a little bit of insight and strategies that you can maybe incorporate into your daily routine in life to help prevent back pain from coming on. Now, before we wrap this video up, I have 2 exciting announcements that I want to make. One is I've created a Facebook group called Back Pain Warriors. And this Facebook group is going to be specific to people that follow this channel and follow me through social media that would like to interact with other like-minded back pain individuals or folks out there, and maybe are looking for inspiration, motivation from others out there that are going through currently similar circumstances, or maybe are just looking for additional tips and information, because I'll be interacting in there more directly with you guys and answering your questions. So check that out on Facebook, Back Pain Warriors. Now, my second exciting announcement that I'm sharing with you guys is that I have developed and will be releasing my first ebook called 30 Days of Low Back Pain. And I'll have more information for you guys, but this is very exciting. It's my first book that I've written, and I'm going to be sharing with you guys. So stay tuned for that, and stay tuned for more information as when that will be released, and I'll have more updates for you guys as we go along. Okay guys, that being said, that's a wrap for this video. Until next time, have a successful and productive day. Take care.